Hi, this is Adriana with Adriana's Healing Massage, and this is the first Movement Monday video. I was inspired by a couple different podcasts that I've been listening to, and I really like an analogy by Scott Sonnen. He talks about a rubber band, and if you keep stretching that rubber band, it eventually just breaks. And I like that idea, he compares that to the muscles, that if you're continually just stretching the muscles and it's not for a specific reason, that eventually you just lose that elasticity you need. So I like the idea of doing more of movement, and you have synovial fluid in each of your joints. And what that's going to do, it's going to increase that blood flow, first of all, and it's going to get that synovial fluid moving. And that's what lubricates your joints. That's what's going to feed your joints. The increased blood flow, it's going to flush out all that inflammation, everything that's just stagnant in that area. So it really just gets things movement. Your brain was developed for complex movement. So let's get moving. So you have this movement, or you have this muscle called the rhomboids. It's underneath your trapezius. So your trapezius comes from the top of your neck, comes out to your shoulders, comes back in, and then down. Your rhomboids is underneath that. It's between the shoulder blades. It's the only muscle that keeps your shoulders back. The opposing muscle is your pectorals. It's a much bigger muscle. It can be up to 1 inch thick. So in order to strengthen those rhomboids, in order to keep those shoulders back, you can do something really simple. It's just arm circles. So what you're going to do is you're going to contract your shoulders, act like you're trying to squeeze them together, and then you're just going to do little arm circles. And then you can just do little arm circles forward. You're going to bring them up, squeeze them together, and then just little ones. And then after you do the little ones, get the pectorals moving, get them opened up. You can do that through a doorway, 2 arms on the doorway and just lunging through. Anything that's going to get those pectorals opened. And then back to the arm circles, squeeze them together, and then you're going to go backwards. And again, opening up the pectorals, and then you can do big ones, forwards, backwards, and then between each of the sets, you just want to make sure you're opening those pecs. However you want to do it, whether it's a stagnant stretch, just getting them opened. And then the next thing we're going to do is just a simple neck roll. You're just going to take your ear to your shoulder, and then just move it down, around, back through, and down and around. And I would suggest doing several of these. If it's stuck anywhere, if you've got, if your vertebrae is getting kind of stuck, then you can just kind of hold it there and just go back through and just kind of rock back and forth. You don't want this to be painful. Your pain scale should be no higher than a 5. Like, it can be just a little bit. You can feel it, oh, okay, like it's tender, and just gently let your body work through that. Again, increasing that synovial fluid, getting the nutrition you need, and flushing everything out. The next one is just shoulder rolls. Super simple. I'm sure we've all done these. You're just up, shrug them. You're just shrugging them forward, and then we're going to shrug them back. Just super, super simple. And then the only stagnant stretch, I like this one because it's moving back and forth. So you're just the idea is you're gonna clasp your hands like that and just bring them forward, and just you should really feel this through your shoulders. And then we're gonna immediately take them back. Again, clasp your hands behind you, pull them back, and then forward, and then back. Just really getting that movement. And then the other thing I suggest is that if you are sitting at a desk all day, is make sure your monitor is the bottom of it is eye level. You should never look down at your monitor, whether you have a stack of books or whatever you need to do to make sure that monitor is up. And then make sure you're never reaching for your keyboard. Make sure you bring your keyboard in, your shoulders are back, and you're typing close to you. Don't ever reach for it. And then next week we should be doing low back and hips. It's another thing that I see a lot. And if you want any more information about what I do, my website is just below. Thanks so much.